Idamycin Pfs Vial contains idarubicin, which is used to treat a certain type of cancer called leukemia. It belongs to a class of drugs known as anthracyclines and works by slowing or stopping the growth of cancer cells. The dosage and timing of Idamycin Pfs Vial will depend on the individual's condition and response to treatment. It is important to follow the doctor's instructions and take the medication at the recommended times for the best results. When using Idamycin Pfs Vial, it will be administered through a vein by a healthcare professional, following your doctor's instructions. The dosage will be determined based on your medical condition, body size, and how you respond to the treatment. If the medication comes into contact with your skin, be sure to wash the area thoroughly with soap and water. If it gets into your eye, flush with water for 15 minutes and seek medical help immediately. It's important to drink plenty of fluids while using this medication, unless your doctor advises otherwise. This can help reduce the risk of certain side effects, such as increased uric acid. Be sure to follow your doctor's instructions for the best results. Some common side effects of Idamycin Pfs Vial include nausea, vomiting, abdominal cramps, diarrhea, headache, and temporary hair loss. Your doctor may prescribe medication to help with these effects, and eating small meals and limiting activity may also help. If these effects persist or worsen, be sure to inform your doctor. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks. Most people who use this medication do not experience serious side effects. However, it's important to contact your doctor if you experience severe abdominal pain, mental/mood changes, numbness/tingling in the arms or legs, rash or blisters on the hands or feet, unusual bleeding or bruising, or seizures. If you notice symptoms of a serious allergic reaction, such as rash, swelling, trouble breathing, or severe dizziness, seek medical help right away. Additionally, pain or sores in the mouth and throat may occur, and it's recommended to brush your teeth gently, avoid mouthwash with alcohol, and eat soft, moist foods. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you experience any very serious side effects, seek medical help immediately. Idamycin Pfs Vial is a medication that should only be given through a slow injection into a vein. It should not be injected into a muscle or under the skin. If the medication accidentally leaks into the skin or muscle around the injection site, it can cause severe damage. If you notice redness, pain, or swelling at or near the injection site, tell your doctor right away. This medication may rarely cause serious heart problems, including heart failure. The risk of heart problems is affected by your dose, medical history, and previous use of this and other drugs. If you notice symptoms such as irregular heartbeat, shortness of breath, swelling ankles/feet, unusual tiredness, or unusual/sudden weight gain, tell your doctor immediately. Idamycin Pfs Vial may also cause severe blood and bone marrow disorders, which can affect your body's ability to stop bleeding or fight infection. If you develop easy bleeding/bruising or signs of infection, such as a sore throat that doesn't go away, fever, or chills, tell your doctor right away. There is a very rare risk of developing other cancers, such as secondary leukemia, when being treated with this medication. It is important to consult your doctor for more details. Before starting treatment with Idamycin Pfs Vial, inform your doctor if you have liver or kidney problems, as your dose may need to be adjusted. Before taking Idamycin Pfs Vial, make sure to inform your doctor if you are allergic to it or other similar medications. Also, discuss your medical history, especially if you have any blood disorders, heart disease, kidney or liver disease, or if you have undergone radiation treatment. Idamycin Pfs Vial may increase your risk of developing infections or worsening existing infections. It's important to avoid contact with anyone who has a contagious infection. Tell your doctor if you have been exposed to an infection. Before getting any vaccinations, let your healthcare professional know that you are using Idamycin Pfs Vial. It is also important to avoid contact with individuals who have recently received live vaccines. To reduce the risk of injury, be cautious with sharp objects and avoid activities that may result in injury. Before undergoing any surgery, inform your doctor about all the medications and products you are using. Older adults may be more sensitive to the side effects of Idamycin Pfs Vial, particularly its effects on the heart. If you are pregnant or planning to become pregnant, talk to your doctor. It is important to use reliable forms of birth control during and after treatment to prevent harm to an unborn baby. It is not recommended to breastfeed while using this medication. Be sure to consult your doctor before breastfeeding. When taking Idamycin Pfs Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Idamycin Pfs Vial include other drugs that may affect the heart, such as trastuzumab and anthracyclines like doxorubicin. It's crucial to discuss any potential drug interactions with your healthcare provider to ensure the safe and effective use of Idamycin Pfs Vial. If you or someone else has taken too much Idamycin Pfs Vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include an irregular heartbeat and severe nausea or vomiting. It's crucial to act quickly in the event of an overdose to ensure proper medical attention is received. It's important to keep up with your lab and medical tests while using Idamycin Pfs Vial, including tests for kidney, liver, and heart function, as well as a complete blood count. Be sure to attend all scheduled medical and lab appointments and consult your doctor for more information. Make sure to take each dose of Idamycin Pfs Vial as directed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. This medication is used to treat certain types of cancer and should be taken at the recommended times for optimal benefits. It is important to follow the dosage instructions provided by your healthcare provider for the best results. This medication is administered in a clinical setting by healthcare professionals and is not meant to be stored at home. It is used to treat certain types of cancer and is typically given as an injection into a vein. The dosage and frequency of administration will depend on the specific condition being treated and the individual's response to the medication. It is important to follow the healthcare provider's instructions for the best results. Remember to discuss any concerns or questions with your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.